Beyond the Bell, Exploring Education in the Bangor School Department, a Bangor School Department podcast.
Welcome to Beyond the Bell, the Bangor School Department podcast, where we explore important topics in education and our community. I'm Dr. Marie Robinson, Superintendent of the Bangor School Department.
And I'm Sarah Luciano, Chair of the Bangor School Committee. Today we're discussing a crucial aspect of student well-being, access to healthcare through our PCHC School-Based Health Center.
We have some fantastic guests today from the PCHC team who provide essential health services right in our schools. Let's welcome them.
Thank you for joining us. Can you introduce yourselves and share a bit about your roles at PCHC's School-Based Health Center?
Hi, my name is Casey Lehman. I want to thank you both for having me on today. I am the program manager for the school-based health centers.
My name is Megan Woodman. I'm a family nurse practitioner.
Healthcare can be a significant issue for many families. What are some of the barriers, or the main barriers, to accessing healthcare that you've observed in our community? And then how does the PCHC School-Based Health Clinic work to overcome these barriers?
Access is a problem for students and staff and their families in our community. We know that walk-in care and urgent cares have been closing around us. Getting into a primary care provider can be difficult. We can provide services for students and families and staff rather quickly on a same-day basis, so people don't have to take a day off from work or a half a day off from work. They don't have to miss school. They can come see us right inside of their school.
Our school-based health center mission is really healthy students learn better. And so we're able to meet the students right where they are. And so the access to the care is very convenient for students, families. It creates less impact to their academic schedule. Parents are not having to leave work to access the care in other areas. So really just meeting the students right where they are.
Wonderful. And that's kind of what we've experienced with the school-based health clinic. So great. Thank you.
Thank you. Can you describe the range of services provided by the School-Based Health Center? What can students and families expect when they visit?
One great thing about PCHC is that we'll see anybody regardless of their ability to pay or their status as a PCHC patient at School-Based Health Center. So you don't have to be a PCHC patient to be seen by us. We provide a very wide range of services, including urgent care sick visits, sports injury visits, evaluations, treatment, primary care and preventative visits, physicals and sports physicals, immunizations, labs, procedures that may be needed, and mental health and counseling services as well.
Great, thank you.
Can you share some of the success stories or positive outcomes that you've seen since the opening of the health center?
What I've seen personally is a great growth in recognition and trust of the staff and providers that PCHC has in the schools. Students recognize us in the hallways. They wave and say hi. They stop in to say hi. I had a young man give me a bracelet today because he wanted me to be happy.
That is really great. I love hearing that.
It's, our presence is valued, and students are becoming familiar with us, and that's great.
And I think one of the success stories that I've heard from one of our clinics was one of the faculty said that they had been putting off going to a provider, just unable to make the appointment or get in, and they came down to the school-based health center. We got them in that day. They were able to get their procedure. They received a cancer diagnosis and was able to get the treatment within just a few weeks. But they had otherwise been postponing and not able to access the care.
That's really amazing. And access to healthcare obviously can lead to some really significant challenges for people. So I've heard nothing but good things as well from the school-based health clinic from my perspective, whether it's staff or families. So we are really, really excited to have the school-based health clinics as part of our department.
We really are. So how do you collaborate with teachers and staff to support students' health needs?
We talk with teachers and staff all the time, always with patient and parent permission, but we email back and forth. Staff, teachers, they stop into the clinic to give us updates or to ask us questions, or to let us know things that we may not know because we're not in the classroom all of the time. But that allows us to make individual plans for students and, once again, kind of meet them where they are, with having the least impact to their academic or their school day and their personal lives.
It's fantastic. Like really taking a very responsive approach to ensure student well-being, it sounds like.
Yeah.
Absolutely.
It's great. So speaking about student well-being, we all know that mental health services are in high demand. I've heard of this myself. Many families are encountering wait lists when looking for services. Can you talk a little bit about the mental health services that you provide and how do you feel these contribute to the students' overall well-being?
So we are seeing a lot of mental health referrals coming in. We are currently providing that service at the high school and to middle school locations over at Cohen and Doughty. We are recruiting for 2 more mental health providers. We recognize there's a need, and we want to respond to that and staff appropriately. But we are finding that these weekly appointments, we're able to get students in. There's no travel time. It's less time that they're missing from their core classes. Megan, do you have anything?
Yeah, the other piece is that we, from the medical provider perspective, we do risk evaluations with students all the time to identify risky behaviors and then treat those or provide them support if needed. And we can also, each of our providers also can do some degree of medication management if that's needed in regard to mental health. So a pretty wide range.
Yeah, so that's great. It's kind of an extra layer of support. Obviously, within the school, we have our school counselors, we have social workers, but then, having that access to a clinician, someone who can, really add that next layer of support is really gives me a sense of ease knowing that we are offering the most possible supportive environment for our students.
Yeah, and since we're supported by the larger umbrella of PCHC, we also can connect students to other services as well, like care management.
Fantastic. Great, thank you.
Thank you. How can parents and families get involved or support the services offered at the health center?
Number 1, I say just call us. If you have a question, if you're not sure what we can or can't do, call us.
Yes. We are always looking for family and community involvement into the school-based health center. We are hosting 2 community advisory board meetings a year, and we would love to have parents and community members from the Bangor community to join this. We will be scheduling, the dates will be available, so if anyone is interested, they could reach out to the school-based health center and request to be a part of that community advisory board.
That sounds great. Do you have any kind of an idea of when those might be scheduled? You said twice a year. Is it spring and fall or?
Yeah, so we are looking to schedule in November a date for the first one, and then we will schedule late spring.
Perfect. Thank you.
Thank you. So thanks for sharing your insights with us today. It's clear that the PCHC School-Based Health Center is making a significant difference in the lives of our students.
Absolutely. Access to healthcare is just essential for student success. And I feel very proud, I know all of us are, feel very proud to have such dedicated professionals in our schools. Thank you so much.
Thank you. And to our listeners, thanks for tuning in to Beyond the Bell. Be sure to like and subscribe and stay connected for more discussion on topics that matter to our